The nightmare scenario that doctors in the country had warned of in April is fast approaching. At the time, senior doctors had written to the government urging it to reconsider its decision to allow congregational prayers during Ramadan and had said that the number of COVID-19 patients in need of urgent medical care would expand exponentially if strict distancing was not enforced. More than a month later, with the government lifting most lockdown restrictions, those fears are turning into a grim reality. According to official data, major hospitals across the country are rapidly running out of capacity, with over 31,000 cases in Karachi alone. Private and public hospitals in the metropolis are becoming overwhelmed. The Sindh Health Department's data shows there are no beds vacant in ICU units in Karachi except for 6 at one hospital. The Pakistan Medical Association has said that major hospitals in Karachi had stopped admitting critical patients. Even the government's Park app showed that ventilators were available in one hospital only, while others were running on limited capacity. In KP, the chairman of the Provincial Doctors Association expressed fears that the province was rapidly heading towards a situation where there will be no space in hospitals to take COVID-19 patients. According to them, most of Peshawar's hospitals had run out of beds, with patients' relatives running from pillar to post in search of a health facility. One hoped that the harrowing numbers of the infected and the dead that were once seen in Italy as COVID-19 peaked there are not reflected in statistics in Pakistan, where doctors are being forced to refuse patients and make difficult choices in rationing ventilators.